So out of the 60 cases that we had sent for genome sequencing, in that 34 have come positive. And of course, this was predicted that it is going to be JN.1. And likewise, all precautionary measures that we have taken, we are continuing to take those precautionary measures. And also we are going in, we are ensuring that all the hospitals are ready in case of more hospitalizations and need of ICU beds and oxygens and ventilators. Both medical education and health department both are working in tandem, and we are ensuring that in every taluka, district and medical college hospitals we are reserving certain wards for COVID patients. So, and also all the required drugs, consumables, all that is being procured also in advance, so that for next 3 months we should have enough in stock. And we are also now advising, our main advisory to the people is, of course, please wear masks, and New Year's is going to be there. So please, follow COVID protocol, keep your hands clean, and maintain some sort of social distancing as far as possible. And especially people who are 60 and above, and people who've got other illnesses, whether it's heart or cancer or liver, kidney, or anything, or if they're on immunosuppressants, then they should be very, very careful, and they should compulsorily wear masks and go out. Testing, now we are ramped up testing. Yesterday we had done about 3,000 tests. So today, of course, our target is 5,000 per day, and that will continue. And we will keep track. Of course, because Karnataka and Kerala are doing more tests, that's why the number of cases are more in Karnataka and Kerala. And Kerala is very high. Karnataka is second place. But that is not a cause of too much worry for us, because we want to keep track of the coronavirus, and whatever precautionary measures that we need to take, we'll be taking. Also, we will be also procuring about 30,000 vaccines. It's a precautionary vaccine, which will help people who have already been vaccinated to take just like a booster dose. So this 30,000 vaccines will be prioritized for those who are sick, or those who need the vaccine with the highest priority, like people who are on immunosuppressants, kidney, liver, heart diseases, or very aged people. For them, these vaccines will be targeted, and then we will see if more is required, then we can procure more. We are going to be fixing a rate for the RT-PCR test and RATs tests, all that. Another 2 days, we've formed a small committee which will discuss with the diagnostics and our people, and what should be the decent rate for the private diagnostics to charge, and that within 2 days we will have a rate fixation done. As far as now there are 7 deaths. In that seven, JN.1 I think is for no.
3, sir. So you have tested 4 samples. Out of 4, 3 have tested positive for JN.1.
Yeah. No. Sorry. We have 7 have died. In that 4 of them genome sequencing has been done. In that 3 are JN.1. But all the 7 who passed away, whether it's JN.1 or not JN.1, whatever it is, have been our technical committee has looked into it. All of them have died due to other reasons, not getting COVID, pneumonia, and lung infections, and and then going into ICU. They've had a lot of other comorbidities, and that's been the reason. So no direct death due to the coronavirus. That has not yet happened. So because this JN.1, as per WHO and Government of India, is a variant of interest, not a variant of concern. So since it's a variant of interest, the health risks are minimal. It can be contagious, but mild symptoms, and will not be dangerous to their life. That's what the guidelines are being told to us.
So there was a procedure last time around for cremating dead bodies as well. This time, are you following anything as such?
No, see, generally nobody should be refused. That's the standard direction will be given, that no one should be refused a dead body which is COVID positive. But we will be telling all our corporations, because most of them will be in cities.
Yeah.
So all the city corporations to ensure that every crematorium has got certain amount of PPE kits, masks and gloves, so that if such a person comes, they can use that to cremate them.
So restrictions for New Year's?
No restrictions, only advisories for all of them, saying that be careful, maintain distance. If you have any symptoms, please wear a mask. And for aged people, compulsorily wear a mask. That's what we are advising. And hopefully, there should not be too much problem. There's no ban or no strict, regulations for New Year's or for any other event, for that matter.